Hey everybody, welcome to it. So right off, we got big news coming out of Montreal, in my neck of the woods, east coast of Canada. It's pretty good. It's pretty close, right? So Quebec health officials have first presumptive case, and the patient is a Montreal area woman just returned back from a trip to Iran from on Monday, and she went to the hospital on Tuesday, and first test results came back positive, and any presumptive positive usually is a positive. So yeah, we're waiting for a second confirmation from the Winnipeg laboratory, and the government. We have been very vigilant as a government. Of course you can be, but we're not ready for this. We're not. Unfortunately, we don't have the way this is spreading in particular as a virus. It can spread when you don't have symptoms, and that's very tricky to track down. And now we have confirmed cases in the United States for sure, where people are catching this with no outside travel. So it's only it's happening everywhere. We're just not seeing it yet. We're not catching these cases because they're flu-like symptoms. So it's you don't, and it's not like you're really sick from this. Most cases are mild, but you're still spreading it. Is the point? And we're while this is spreading, it's going to pop up and bite us in the ass at any moment. We don't know when, right? It's just a matter of time before an outbreak happens close to us. So we're going to go over some things today. Some latest news and developments, and check out what was going on today with the CDC's. They were getting grilled today by the internal, or not the internal affairs, but the foreign affairs ministry in the United States. So the CDC answered some questions, and they were really put on the spot as to how they were reacting to this. And there's some really good points in here, and they can't be overmissed, but they're being overlooked, but they are being overlooked on every level, because we're not taking this as serious as we should be. I really believe that. I've been saying it since day one. I've been saying it, and I got a little, a lot of people are saying, "What the hell, dude? Like, give it up." But it's more important to get the news out, right? It's right, and I know it's right. And if it helps one or two people, or even one person, help them prepare a little bit quicker, and get ready, then it was all worth it, really. So yeah, again, this one here is just from Global News. Montreal has first probable case. Yeah, it's we don't know where this is spreading. She got on a flight Monday, right? It's only, she went there on Tuesday, but that she could have definitely infected other people. And how many other people like her might have got through, we don't know, that might have been infected, right? We're not testing really for this like we should be. South Korea is doing a phenomenal job, and by the way, South Korea, their numbers have surpassed 2,000 in 7 days. They went from like less than a dozen cases to 2,000 cases. Plus, they got like 200,000 people tested already, but they just got to wait for the results. And the results for this take up to 72 hours for this type of test. Especially if we're double testing this, right? So like, somebody, she went to this specific woman went to the hospital from traveling back from Iran, and returned to Montreal on Monday, and went to the clinic on Tuesday with light symptoms. Officials said her first test results came in on Thursday afternoon. And due to her light symptoms, the victim does not need hospitalization, so she's sent home. Well, yes, and they want to keep people home. There's this virus is absolutely evil. I will just tell you straight up. And I'm not sugarcoating it. We don't know where this is going to go. It's obviously spreading beyond our control. We can't see this. We don't know where it is. It's already out of control globally. We just haven't picked it up yet on our radar, on our medical testing. There's lots of people spreading this around as we speak, and it's just a matter of time, unfortunately, before one of these clusters pops up somewhere close to home or right in our home. So, you don't want to be running to the store when everybody else is running to the store. Get your stuff together, right? We're going to go over that a little later on. Going to keep going into the news here. This is crazy. A dog has tested positive for this. Now, I've been following the science for this for a long time, and there's some very unique characteristics about this virus, about how it infects us and what binding receptor sites it uses to infect our cells. It's very specific. It's very wow, it's almost too good, to be natural in a sense. And scientists are saying the same thing. They really are. And a lot of people are saying this now, even talking on mainstream media a lot more about that this might have got out of the lab. Because Wuhan, China, where this all began, does have a level 4 maximum security biolaboratory where they can do gene editing and make monstrous things even worse, right? They can take Ebola and they can take SARS and they can take, and that's what they do. They make it worse, but they don't do it for, let's say, always a negative purpose. We don't know, but they're called dual purpose scientific studies. And what that means is dual purpose means that they can be used for good or they can be used for bad, right? Because what we need to do to develop better vaccines is to study these vector points of this virus, right? Of different viruses. The more vectors and the more ways and vectors are basically just the way that the virus enters our cell, right? The more ways we can figure out how the virus enters our cells, the better vaccines we can develop beforehand, right? So they do these scientific studies and they make bad things worse to just to try and do good things. But sometimes there can be let's just say human error, and it's possible, and we really have to think about that. If this is in fact something that is man-made, we got to really put our guard up real quick, because especially from something not being in nature, and if it just introduced into nature, we don't know how this is going to evolve. We don't know how it's going to mutate. We don't know if there's already is mutations. There's so many scientific questions, and really no concrete answers. But there is a lot of preliminary studies that suggest this is highly viral, and it's very skeptical about how it got these certain attributes or properties, or let's just say abilities to infect certain cells. So this brings us back to the dog, right? The dog is not a mammal, I don't think. It might be. But if in fact, if in fact we can infect animals, or not we can, but this virus initially, it can just maybe infect a lot more hosts. Hosts being people that it can infect. So by gaining these certain abilities that it scientifically does have, it does have these abilities as of right now to infect the ACE2 receptor. And that is a really curious binding receptor, because it has the ability to hide from the immune system. By using this receptor, the immune system is not going to pick up the virus right away, right? It can hide by using these, and it's a lot, right? But basically it has some very unique properties to this virus in of itself that no other virus has. It really doesn't, and we're really cautious about talking about this, of course, but at the same time it does have to be addressed. And because the scientific data is in fact there now. But if this can infect animals, this could really fuck us in the ass. I'm sorry, but let's just say it gets into the cattle or the dairy products, the chickens, the pigs, I'm just really curious, because if that's the case, we could probably only live off of fish. Really, I don't even know. I don't think it could infect the saltwater fish, maybe freshwater fish, because we do know that it is transmissible by water, and we don't know how long it could live in the water. We don't know how long it would take to infect it. Like, but this is just all speculative, of course, right now. We don't know if, but surely a dog just came back positive, and not only one report here, we got a second report of this. Hong Kong finds traces of COD in pet dog. And this is from the Straits Times, and they're pretty good. Sure, no. So, Hong Kong authorities said Friday that they quarantined a pet dog. They took oral samples and they came back with a positive, although they added they did not have evidence yet that it can be transmitted to pets. Well, so how did the dog get it? The Fisheries and Conservation Department are in charge of this right now, and they are doing some more test results. But the dog did come back to definitely have it. And there was news reports back weeks ago about Chinese people throwing their dogs and pets and cats and everything right out the window of high-rise buildings. And I thought that was like, no, that's not true. But then there was a few actually more articles about that, and I said, well, what the hell? Maybe it's because, they don't have food for the pets, and that could be one thing too. The pets are starving, and, most people are quarantined in their place. They're not allowed to leave in China. So, and it's under very heavy military rule. So, they're not going to, but maybe, one of the articles did say, in fact, that, people were believing that their pets were infected. And maybe they were, maybe the pets were getting sick. Maybe they're getting really sick from this. And if that's the case, we could be heading for a whole different level here. And it's very, concerning to think about that this here could be man-made, of course. And but it's not a conspiracy theory anymore. There actually is some pretty good scientific preliminary data to support this. They don't suggest that it's natural recombination, which means mutation, which can happen, right? Mutations do happen, but to have a viable mutation doing what it's doing, like this here virus in itself is, it seems too perfect, because what it's doing is it's not being really deadly, but it's being just deadly enough that it can spread globally, and it's being spread asymptomatically, which means you don't have symptoms. And that's really hard to track, especially if one of these people who flew from somewhere or, was infected somebody else that maybe wasn't a contact or they couldn't trace. How many other people did that person infect, and how many other people did those people infect? And, there's a 14-day and higher incubation period on this specific virus, meaning that you could have this and be infectious and not show any symptoms. They say now up to 27 days is the longest one they recorded so far. A person that had tested positive was 27 days before they showed symptoms. Scary shit, eh? But not only that, they were contagious during that whole time. From those 27 days that they weren't showing any symptoms, they could give it to somebody else if you got close to them. So yeah, this is very, very difficult to find in our society, given that it's one of the busiest flu seasons in actually what they're saying in decades. Really, they said it's one of the worst flu seasons in decades, and now I don't know if that's just that's just adding to it, right? Of course. And because you can't test everybody for this. You can't. We don't have the abilities. We don't have the laboratory capacity to test for this. There's no other way than, a PCR test, which takes up to 72 hours on a good day. That's if everything's going right. These labs are working at capacity right now to help global efforts. We can't really handle a whole lot. Really, we can't. That's why they're sending people home, self-isolation, get them out of the hospital, because we do know that this can infect hospitals. In fact, it will, and it does. So, if you had a infected person there, let's say that might have infected a doctor before they knew they were positive, right? Somebody comes in, says, oh, I'm really sick, and maybe somebody wasn't wearing the mask, sitting in the waiting room for like, certain hospitals you can sit in the waiting room up to 8 hours, 10 hours. How many people could you infect in that time? If you weren't aware that you had this, and you were just really sick, and some people just might not even know about this right now. Some people, I still find that hard to believe, but even some people you talk to on the street, and I was talking to some people, and it's just, and they're just kind of like, oh yeah, that's, and they're kind of oblivious to the situation, right? They just, and you can't tell them. Like, if you tell them, then you just sound like a weirdo, but here I am doing it. No, but it's to get the information out to people who do want to, listen to this, and I'm behind a fucking microphone, so I just spit it, and you just gotta listen. Or just, turn the channel off, whatever you want to do, but maybe somebody will recognize, right? So in PEI, this is where I'm at, neck of the woods. We don't even have a risk assessment right now. They just said, it's continuously being reassessed, and that Canada's public health officer is in close contact with PEI's chief public health office to monitor and rapidly identify and manage cases. Well, yeah, that's fantastic. I have very little faith. I do, because the fact that if this blows up, which it will, you just take a message from China, and just take a message from South Korea, Italy, Iran, anywheres that has an outbreak right now. If we could just look at what's happening there, we can only take a model picture, a cookie cutter experience of what's going to happen everywhere else, right? That's just the way it's going to happen. They'll come in, they'll isolate, they'll quarantine, they'll shut it down, and you just won't be able to leave. Now you might be allowing, certain things for gathering supplies. I don't know how that's going to work, if you're under isolation, especially if your city's under isolation. We don't know who possibly could have this. It could be the guy packing the fucking food in your grocery aisle, right? We don't know. And like, you're just going up and picking up, produce or whatever. And yeah, we don't know. Especially at fast food restaurants. And I'm not trying to, that's damn serious. I haven't got a coffee at Tim Hortons in weeks. I'm serious. I bought coffee. And, I just don't trust it. I don't. And yes, I am going to kind of moderate extremes to protect myself and my family, of course. This thing is epic. This thing is vicious as fuck. Excuse my language. But it's no joke. Okay, so yeah, and University of Prince Edward Island is where I'm from. They got a notice out about this as well. Just encouraging people to, take proper hygiene, go seek professional medical attention. And here we have coronavirus outbreak in Canada timeline. So as of February 24th, there have been 13 cases of coronavirus. Well, we got some more. We're going to have 15, I believe, here very soon. So on the 23rd of January, 5 or 6 people were being monitored for signs of the virus, including at least one in Quebec who has since been cleared, and another in Vancouver. Okay, so that was the 23rd of January. 25th, first presumptive case was announced at Sunnybrook in Toronto. January 27th, Ontario announced man and his wife were second presumptive cases. 22nd, these people were out possibly, or could have possibly infected other people. Most likely infected other people. So we're just waiting for a pocket of this to blow up, right? January 28th, presumptive case in British Columbia was announced. 29th, government had issued a travel advisory to non-essential travel to China. On the 31st, the third case in Ontario, which they tested, and she came up negative the first time. So she went back home, she did her thing, and she went to London, Ontario, and went to the hospital like 36 hours later because she wasn't feeling good and tested positive. Now she might have got this on the flight over, because she did return. That presumptive case, or that negative case, that in fact turned out to be positive. She flew directly from China, and yeah, I believe it was Wuhan, and she in fact did possibly catch it on the plane, or already had it, and it just took a little while before it actually infected her. On February 6th, there were 2 presumptive cases in BC, and February 14th, involving a woman in her 30s from Vancouver. She went to the hospital, she had symptoms. We don't know if somebody who's at the hospital currently sick with this, passing it around, not knowing. We just don't know, right? And we can only take the best precautions we can, but it's not going to be enough, unfortunately. February 20th, BC announced 6 cases. A woman in her 60s returned from Iran. That is very interesting, because Iran has an extremely big breakout right now. A lot of people are saying that it could be up to a third of the population infected in heavily populated areas. They're expecting, like, they think that this is absolutely wildfire in there right now, because they're having a lot of deaths for sure. And they're finding even people in their homes just dead from this, and coming back in fact positive. So people are dying in their homes in Iran. People are collapsing in the streets in South Korea like they were in China. Those videos are very shocking, and they're dramatic, and they first got ruled out as everybody as being fake, because of course nobody could really realize that something like this could actually happen. Unfortunately, this is real, and it's happening. And to what degree? Well, we can only speculate how far this is going to go. But if we don't stop the virus, it's going to wipe out everything, right? That's just the way it is. All of our supply networks, everything, will have to go back to living off the land. Or we might be able to gather some creature comforts in the meantime. But it could go there. It really could, because we still haven't found a way to stop this, and a vaccine is a ways away. And we could, like, what if our top officials, or our scientists, or whoever, get infected by this? We don't know, right? They still got to go out and buy groceries and do their stuff and everything. Like, what if they contract this somewhere in the city, and on the way to work, or infect their other people that they're working with, and these are our top scientists? It could happen. That's the gravity of the situation. It really is. Like, this knows no borders. It knows no names. This will infect anyone. And it doesn't, no matter what the first news came out that was saying, well, this only affects certain people. No, this affects everybody, because we have no immunity to this. It's called a novel coronavirus, but novel meaning new. And we have no immunity built up to this. So if we get this in our system, it will in fact infect us. And we're still very unsure about anything about this. We're saying that people are recovering, but I really don't think that's possible. And that's just my own, I'm not saying for everybody, but I think that this here is something that, goes dormant, and it goes into like a recessive kind of phase, and we can't detect it. Actually, interestingly enough, the Ontario Health Minister said that there was in fact viral load in the samples that were coming back negative, and they didn't know what that meant, meaning that there is still virus in the samples, but it's not showing positive, right, in the testing. My assumption would be that it's dormant, and it's just something, whatever kind of biological processes are going to activate that again, and then it comes on to a second wave, because we now have reports coming out of China and places about people getting second infections. But I don't think people are getting this twice. I think that once they get it, they're not really getting better. This thing just kind of goes to sleep for a little bit, does whatever it's doing in your system, and wakes up again, and whatever it does from there. It's quite tricky, and it's got scientists baffled. It really does. Scientists are like, what the hell? And I've been following the sciences on it as well, and I am like, what the hell? Because it speaks volumes. It does. It's science. So February 24th, another presumptive case. 25th, Air Canada flight. Yeah, like wow, they suspended the flights just on February 25th, and this was in fact a major outbreak, on January 20th. It was in fact a major outbreak. Like that's when we seen all the videos of people passing out in the streets in China, and those are actually real. Those aren't fake. Um, so that was happening at that time, but all the travel was going. Everybody was still flying. Everybody was coming in. Students going to and from. You know what I mean? But we only stopped our. We only really stopped. Like a month after, which is very scary. And Montreal's first case, February 27th, which is today. So, it's only a matter of time before we get a cluster. And, take care. Stock up. We don't know where this is going to go. Like, we might have to, go totally apocalyptic, fucking mode here. I'm serious. And I'm not trying to freak anybody out. I'm just telling you how it is. Because, you know what I mean? If you avoid this or you try to deny that it's not happening, well, it's still going to happen. And it's still going to bite you in the ass. So, take precautions, right? Be chill about it, be prepared. Just, you got to. And nobody knows how well. Oh, yeah, I forgot about this. So, Pope Francis possibly has coronavirus. And this is, in fact, real. Like, this is legit. He was going, he canceled the big, whatever. He was at Ash Wednesday. This is from Ash Wednesday in Rome, and he was sick. He didn't want to cancel this event. I guess it was a big thing, and there's a lot of people, and you know how religious people are. God will save me, and all this kind of stuff. God will stop the virus. Well, I really don't think he has a hand in that. But that's kind of the mindset, right? That's kind of the, especially in Iran. They don't believe in that. They truly believe that, this, whatever the deity that they believe in is going to, protect them from this. So, no. So the Pope obviously, and he's, sick. He's sick, right? And this is still Ash Wednesday. This isn't a different picture. This is legit. He was going around waving hi everybody. And you see this woman here. She's got a face mask on, right? So it is. And they do in fact have an outbreak there right now. They do have an outbreak on their hands. They don't know how many cases, but they definitely have an outbreak, and it could be a lot more than what we think, right? So he had a blustery schedule late in the day, his public general audience on Wednesday, and the Ash Wednesday service later in the day in Rome. So Ash Wednesday services were canceled or limited in areas of northern Italy hit by the spread of the coronavirus. But it's still Italy and northern Italy and the Vatican and the Royal City. Yeah, it's hot spots for tourists. It's hot spots for travel, major congregations of people. So it's going to spread like wildfire there, right? And here's the Time magazine's Time. They did a thing, and they said, slight illness. He's got a slight illness, and this guy here, I think all these people, why wouldn't they wear face masks? Because he's godlike, and we could never get infected. Pope Francis is sick and skipped a planned mass with Rome clergy around town on Thursday. But he visibly was sick, and he was having a hard time breathing. If he in fact has the coronavirus, he will in fact, subside to this very quickly, just because of his age and his weakened immune system and all the, because this does in fact attack our immune system. It does some weird things. I don't know. It's a lot of iffy stuff, right? So there was no word from the Vatican about the nature of his illness, but the Pope was seen coughing and blowing his nose during the Ash Wednesday Mass. And also Iran's foreign health minister, the health minister in Iran, he's actually got the coronavirus as well. So could the president? Could the prime minister? Could his, the cabinet? Could, the military? Actually, there's military, U.S. military does have an infection of this, but they're stationed in South Korea. and they're under watch, of course. Um, how coronavirus works in Canada. My neck of the woods, of course, Canada, yay. Well, we do have, we've got a pretty good infrastructure here on our own. You know what I mean? We can handle bare necessities. You know what I mean? We might not have the same kind of creature comforts as we do now, but I'm sure as Canadians, like we'll be able to manage for a little while, but for how long, or we don't know how many people this could infect. It's all about the people who get infected. What if these factory workers get infected? What if these production line workers get infected? It's possible. And like, there's nobody just to run the power grid. There's nobody to run anything. Ooh, it's 100% possible. Well, this officially, like, is across every place across the globe in less than a couple of months, and not only that, it's spreading quite rapidly. We can't see this. We don't know who has it. We don't know what could be affected at this moment. Anything could, like, the front line could go down. Let's just say the emergency services goes down, which because that's what happened with China first, and then they had to send in the military, but then the military got sick as well. Excuse me. I don't got the coronavirus, I don't think. I just smoke a lot of Mary Jane, kill the pain. Yeah, I got pains. I'm old. I'm susceptible. So, what else? Coronavirus in Canada. What are the next steps? Well, we don't know. It all depends on, again, who this infects and where it infects. In a situation like this, there is no game plan that's going to be decisive or concrete. It's you're going to have to go with, option A, of course, and then keep going B, C, D, E, F, G as it as it develops, because we don't know what this is going to do. It's a virus. We can't see it, and it affects people. People are vital to certain things, especially medical care, factories, processes, all that kind of stuff. It's very vital to have people who are knowledgeable how to work this thing, and have them producing this stuff, right? Because with them gone, let's just say, it could open up a whole new can of worms, let's just say. And we really have to be aware of that. Like, we have to be preparing for the worst right now. Absolutely. I was preparing for the worst 3 weeks ago. I really was. And people, like, went 3 weeks ago, if I said coronavirus, most people didn't even know what the fuck you were talking about. Excuse me, language again. But they really didn't. They had no idea what you were talking about. They were just like, what? Virus? Coronavirus? What the hell's a coronavirus? Seriously, people just had no idea. Not a clue, unfortunately. So, what about it's protection? I'm glad you asked, because there is very limited protection with one of these guys. N95 masks, and N95 just means that it filters out 95% of particles, right? N99, 99% of particles, obviously. So it's important. These, if it's all you got, it's all you got, right? Of course. Now these cool flow ones, they're a little bit better. They're form fit. They're actually a little better, but you gotta, if you got a beard, it's not gonna work. You'll have to shave that. And then again, this one here, particle respirator, is the same kind, the N100. It filters, to block 100% of everything. It's good. It's effective, right? For that one. But there's a lot of there's a lot of, you'd want to be wearing glasses or goggles, right? Because you can catch this through your eyes. You really, really can. And so my go-to, and I would definitely, full face respirator, right, 100%. And if you can't, one of these guys, right, and some goggles, some sealed goggles, like skiing goggles or motorcycle goggles, something like that, something that's going to keep it out, right. But obviously the full face is the way to go for sure. It really is. And they're about $300, depending where you get them, and you probably are going to have a hard time getting them right now. Of course, on Amazon, yeah, you actually, there's, I'm not even going to click on those because there's nothing available. There really is not. So yeah, facial hair, as I was just saying, guidelines, facial hair, coronavirus. Um, this is what you got to do. Goatees, beards, any of that stuff, no way, man. Like it will not create a seal, right? It's you may as well not even wear a mask if it's not making a proper seal to your face. So of course, 8 survival tips that could help you survive. Well, it's the apocalypse, but well, this here is the apocalypse. That's what they're referring to. But seeds, great seeds. Seeds are good. Seeds are great. You can plant gardens with seeds. You can grow marijuana with seeds, and seeds are good. Sunflower seeds, definitely, especially if you're a smoker. Cigarettes might become low commodity pretty soon. Just saying. I don't know. Everything else starts shutting down. Factories, places where we depend upon, our products to make these, everything go around almost comes out of China. So yeah, just it's not looking good, folks. It really is not. So, and I mean, like I changed my profile picture to Rick from The Walking Dead. I did. Because why? Because that's who I'm gonna be. That's my character. In the apocalypse, I gotta get a cowboy hat though. Get some boots. I actually don't want the boots. But anyway, you never know, right? We just don't know. We just don't know. No more supply trucks. What would happen if the grid goes down? Right? Of course, there would be no more supplies coming in. Especially quarantine situations. They might let certain supplies come in, but it's still going to be very limited. It's not going to be like you're going to the grocery store and just picking what you want. You're going to have selection of like whatever's there. All the stores would close. Yes, well, all the stores would close because that's exactly what happened in every other city so far in this situation that had an outbreak. Everyone, everywhere. That's exactly what happened. Riots, people going batshit crazy because you know what? When it comes down to it and people start running out of supplies, people will get desperate. People will start taking to the streets eventually. Or for whatever reason, we don't know. But supplies definitely being one of them. We don't know. There could be a lot of reasons that people would just take to the streets and go batshit crazy. Schools would be shut down. Yes, of course. Commerce would cease. Yes, of course. Your money's going to be useless. So, it really will be. You might be able to use cash at the very first, but after a while, it's not going to become. It's going to be more trading. I'll trade you some Pop-Tarts for some Twinkies or whatever. So we need some food that's going to last a long time. Pop-Tarts and Twinkies go a while. Twinkies are known to survive the fucking nuclear fallout. So, and that was actually a scientific study, believe it or not. And a teacher did this experiment where he ate a 25-year-old pack of Twinkies, and he said, other than it being kind of dry and stale, he said that they weren't that bad. And he really did do that. So gasoline would be on. Maybe I don't think we're gonna have a problem with that, just due to the quarantines, and probably the quarantines would create. If we don't know how this is gonna unfold. So cell service would stop, yes, quite most likely at some point in stage. If it does go down, we're relying on technicians to keep this stuff running. What if those technicians get sick? Right? We don't know how this is going to affect our grid. We don't. So, we got ham radio, CB radio, shortwave. Those devices will definitely come in handy. Oof. Post offices would close. Yes, of course they would. Air conditioning would not work. I don't think that'd be. I think that's the last of our worries. Heaters wouldn't work. Maybe. Most people, could probably still figure out a way to get warm. No more running water. Maybe depending on where you live or where you're at. But it's always a possibility. And it's also a possibility that the water could become contaminated with the virus itself, because we do know scientific evidence that it does live in the water. How long, we don't know, but it does live in the water, in fact. So, another thing here from the U.S. Marines, and they're saying, it's emergency preparedness program. Of course, water, food, non-perishables, can openers, first aid kits, prescription medications, dust masks, sanitation supplies, flashlights, radio, extra batteries, some money probably won't matter, wrenches, tools, stuff like that, local maps, emergency plan, point of contact information, like keep in contact with your friends and family and stuff like that in case shit does go fucking south real quick. Maybe you might want to have a plan for getting together or whatever you're gonna do. Hunker down, and all your stuff, right? Like, we don't know, diapers, all that kind of stuff, baby foods and stuff, like, all that kind of stuff. Like, it could cease to exist after a couple of months, right? It really could. So, or we don't even know how long. Like, it just takes a matter of them announcing a pandemic, or not a pandemic, but an outbreak in your local area and going into quarantine, and then next thing you know, obviously supplies are gonna go real quick. So with that being said, I am going to go into question period here from the CDC State Department. I'm just going to let this roll for a little bit, and as I maybe feel like I should interrupt or interject with my own with my own opinions, I will do so, or at least not my own opinions, but there's other not speculative, but there's other science that could support other areas, right? But this is the CDC getting, they're doing a testifying against, my goodness, the Foreign Affairs are grilling basically the CDC, right, and asking them about how good a job they're doing, but they're not doing such a good a job. They're really not. They're not prepared, especially in the U.S. This is the United States. United States isn't real. They got a big problem on their hands, I think, already. I really do. They're just not see it yet. Canada is, well, we still don't know. Nobody knows. But I think Canada does have a better response plan in place for this than the States, because Trump cut back a lot of extracurricular spending, let's say, and these types of budget allowances were definitely in those cutbacks. So they're definitely doing some backtracking here. Anyway, straight into this, and it's good information. These guys are on, these guys that are from the Foreign Affairs, they're asking some really good questions, and they're not giving these guys any slack. They're not. They're drilling them. They trust. And Dr. Redfield here, well, he's just he's a pretty chill fellow, but I think he wants to get the information out to the people too. But he's got to be very careful. Everybody's got to be very careful about how they say and what they say. But they're saying volumes if you listen very closely. So without further ado, I'm going to go for a smoke, and you guys do what you do. Take care. I'm going to leave this and interject as I will.
Efforts to direct flights from mainland China to 11 U.S. airports continue. CDC is working closely with Customs and Border Protection to screen arriving passengers from mainland China for illness and to identify people at high risk of exposure to this new virus and ensure that they are referred for the appropriate public health follow-up. To inform future travelers of the virus and where it's spreading, CDC continues to post travel advisories and alerts. Specifically, China and South Korea are now level 3 warnings that advise travelers against non-essential travel. Finally, CDC's current assessment into the United States is the risk of this infection remains low. However, we do anticipate new community cases. We have implemented a successful containment strategy, but we must be prepared to move to a blended containment mitigation approach. We also need to make sure we continue to strengthen our public health infrastructure, as alluded to by the chairman, and is ready for broader community spread. CDC and HHS will continue to keep members of Congress informed of new developments. We recognize that you are trusted leaders in your community, and communication with the public is essential during this emergency. Thank you, and I look forward to your questions.
Thank you, Director. I will now turn to my opening questions, and then I'll recognize the ranking member and our other members for 5 minutes for the purpose of questioning the witness. Director, in my opening statement, as well as you alluded to it in your opening statement, of this potential first patient of community spread. And it is in my home county, Sacramento County, and the patient's housed at the hospital that I used to attend in and have taught lots of medical students in. You know, in talking to my colleagues earlier today and getting a sense of you know, the timeline of this patient, one thing is a bit concerning. You know, I've taken care of patients like this who get transferred, who are intubated, who you don't have a sense of what the respiratory diagnosis is. You know, cultures are coming back negative, et cetera. And in this case, it does seem like last Wednesday, the medical staff asked for a test of coronavirus, and were told this patient didn't meet the criteria and this was not a coronavirus patient. As the patient worsened, it does sound like this past Sunday there was an insistence and a strong push, and ultimately the patient did get tested. And we know the results that came back 72 hours later as a positive test. A question that I'd have, and maybe it's twofold. Number one, what current criteria are we using to determine who's going to get a test and who's not going to get a test? You know, when a doctor caring for this patient and they're looking at a patient, they request that it's a no-brainer. We ought to do that test based on the medical expertise of the folks that are trying to confirm a diagnosis. At a minimum, with this new case, we ought to rethink what those criteria are, and I'd be curious to hear what criteria we're using today and if the CDC is updating that criteria. And then the second component is, you know, it is our testing capabilities seem a bit too slow at this juncture, and I'd be curious to hear what we're doing to increase the rapidity and availability of tests if we are getting testing kits out to all 50 states, as well as, you know, more broadly to you know, cities and others. And then, you know, it did take 72 hours from testing to get the results. And, you know, if we could get those testing facilities a little bit closer, I'd be curious to see how CDC is thinking about that. And I'm also told one of my sister institutions, UCSF, they've produced a more rapid test, need the ability to get some samples to confirm the specificity and sensitivity of that test. And there's some private sector companies that are also working on rapid diagnostic tools as well. So, Dr. Redfield.
Mr. Chairman, thank you for the questions. First, I think you know when this outbreak started, for better or worse, even in China, it was linked to whether you were exposed to the sea market, or food market. So obviously every confirmed case was from the market. And then when discussions I had with the Chinese CDC director, I suggested they go out and look at other people with flu-like illness, and of course then they reported that there were many cases that were not on the market. When the United States began this PUI, we had the epidemiological advantage of a link to Hubei initially, where most of the cases came from. Clearly, what's been demonstrated by the recent case is that's no longer operational. I will tell you that as soon as that case was recognized, we met and we revised our case definition for persons under investigation, and today that has been posted along with a new health advisory that the recommendation should be when a clinician or a public health individual suspects coronavirus, then we should be able to get a test for coronavirus. So that's the current guidance that went out today. This is a fluid situation. And your second question is also critical. How do we expand the availability of testing? We think it was an accomplishment to, within a week, to develop a test so we could get eyes on this, and I think the CDC scientists were able to do that. But that was not to take away the broader responsibility for the private sector to come in to be able to provide broader testing for the non-public health community. We've had aggressive discussions about how to expand that, and we are continuing. We have shipped our kits, as you know, initially out to many, many jurisdictions. We had trouble with one of the controls. That has now been corrected, and there are now 40 jurisdictions that have the ability to do the test modified with the FDA approval. And in the next, today, tomorrow, we anticipate more kits from the private sector that have been contracted by CDC to get out. And hopefully, our real goal is that LabCorp and Mayo Clinic and others, but you get at the root of it, why is there a difference? And I used to run a diagnostic lab and develop tests. The other countries have the ability for someone like me to develop a laboratory test and to deploy it. In our country, we develop a laboratory test and we need to go through a regulatory process in order to get it deployed. And again, I'm not criticizing the regulatory process. I'm just saying that's the difference. And many labs in this country, many hospitals could stand up, as you mentioned, San Francisco and other, your own, Davis could stand up a test within several days, because we've published the sequences and the methods and exactly how to do this. And that's how that one company, IDT, is now ready to sell a test, which is really basically a copy of the CDC test. So I do think we have to look at that, because this is an example where we were slowed, in a sense, because of the way we want to assure accuracy of these diagnostic tests. And I know you all are wrestling with that, but we are having more kits out later today that are going to be sent to the states. The state of California, I talked to your Secretary of Health just today, because they were down to 200 tests. We're sending more out there. There are 3 laboratories now, I'm told, in California that have the ability to do the test themselves. But both of your points are very, very important. We take them very seriously. One of least we're not going to let happen again, because we corrected it after the first case. And the other, we're working hard to get these tests out and hoping that the private sector comes in for the clinical use. CDC develops them for the public health use, and we need the private sector to come in for the clinical.
Director, I appreciate the change in the criteria and applaud that. I do think this is a unique situation where we need all hands on deck, and we do need to take a look at speeding up the regulatory process. We do need to allow the academics and those that have the ability to develop their own testing capabilities to quickly move through the process to make sure these are sensitive and specific and accurate diagnostic tests. And then if the private sector can augment our ability, especially now that there may be community spread, we've got to stop the bottleneck, and we've got to get these tests out to all parts of the country. So we can take that up here, but I do, looking at the administration, whatever we can do to speed up that regulatory process to make testing readily available to the practitioners that are out there. Yeah, with that, let me recognize the ranking member.
No, I appreciate it, and I appreciate y'all's testimony. And I think what you were just bringing up is a lot of the questions I had. I assume it's a PCR test or an ELISA test. Okay. The variation in those, you guys created that, and I think along that lines there should be provisional approvals quickly. And that's thing, if you guys are in a bottleneck where you can't get that, let us know so we can help relieve that, and then do the testing and verification down the road. But you have to have a place to start. And then when we get to the point where we have private manufacturing of these, we just need to make sure that we're all on the same page. It's the same test, so we don't have a variation in sensitivity or specificity, and that we need to make sure that the other countries are doing the same. My concern is, with so much of the APIs being created in China, about 85% plus is what I've heard, I look at it from a national security standpoint, or a national health standpoint. Not just our country, but other countries. If somebody needs Advil and you've got a population of 1.3 billion people, are they going to service their customers first before over here? And I think this is a wake-up call for American manufacturers in our pharmaceutical countries not to be dependent on a country. What are your thoughts about that? Whoever wants to tackle that. Mr. Fritz, you're the one.
Thank you, Ranking Member Yoho. There's clearly going to be all sorts of economic impacts as the outbreak continues to develop. We are paying very, very close attention to not just the general macroeconomic impacts that are going to occur with regard to the United States economy and other economies around the world, but also to the impacts on supply chains, and particularly, as you mentioned, supply chains that are important to our ability to react to future instances, future outbreaks. I don't have anything that I can share with you right now, Ranking Member, in terms of what those responses will look like, but it is something that we're looking at very carefully. And we have people across the interagency process who are actively considering ways we can make sure that we are able to make sure that we do have access to the necessary supply chains.
All right. Let me ask about the cooperation. Do you guys feel that the cooperation is adequate with the Chinese government as far as transparency, just working side by side, or do you feel like it's, here's the information we'll give you, and kind of guarded?
Yeah, I'll just kind of interject there for a second. Yeah, it's. I like using big words because I'm on the internet. So I'm gonna interrupt there for a minute, and yeah, like what he was saying with the supply chains, but like he was saying, just Advil as an example, right? That's one of many vital resources that come from China that we kind of depend upon, and then not only us in Canada, everywhere around the world, and that's going to be impacted for sure, right? And we don't know how far this is going to go, right? We got all these people predicting these models, but what we're seeing, is in fact, multi, I'd say country spread now, and we have sustained spread on multiple places outside of China, right? We really do. It's only a matter of time. It's not a matter of if. It's only a matter of time. Seriously. And you can take this information and do what you want with it, but we're going to still keep rolling with this. But it's very vital to take this serious, of course, right? And that's my mission, that's my goal, is to try to get people shifting gears here, because you really need to. You don't want to be caught in the rat race where all that hustle and bustle of people are running to the stores at the same time. It was it's a cookie cutter experience of what we're going to see here anywhere else that happened everywhere else so far. It's exactly what happened every other place. People ran to the stores and the shelves were cleared in an instant. They really were. And you know what went first? Toilet paper. Toilet paper was the first fucking thing to be unavailable in most countries, like once it happened, right? And that's just the way it is. People are going to eat toilet paper. I don't know. I could think of some toilet paper's bulky too. You couldn't really carry a lot of toilet paper. I don't know. I'd take my chances. I don't know if maybe with some leaves if I had to instead of toilet paper. I don't know. Unless you just got like a big trunk. Anyway, I'm getting off topic. So yeah, it's a lot, right? We don't know where this is gonna go, and that's the whole problem. So these guys are going to continue grilling the CDC, and there is some very good questions coming up after. There's another woman who speaks, but then there's an Asian man who speaks, and he just has no give. He's relentless, and the CDC is also tripping on their questions. So we're going to see here in this broadcast some very big red flags. I promise you. If you haven't seen this already, let's just watch it. I kind of picked out a good starting point where the question period begins. So,
sir, why don't I take a first shot at that on certainly with regards to the evacuation of our personnel and American citizens. Very diplomatically and logistically challenging. I would have to say that we were able to achieve a very high level of coordination with the relevant Chinese authorities to make the 5 flights that we got into and out of Wuhan happen. They weren't easy, but we did, in fact, we were able to rely on our Chinese counterparts working with us to make sure that those succeeded.
Do you feel like they're treating all the countries that way? Because we heard the reports that they weren't letting the Taiwanese out.
I
Or
wouldn't
that
be
they
able to
sent some
characterize
sick-
whether they've been able, whether them treating everyone as well as they've been treating us. I do know that they have worked well with a number of other partners, but I've heard the similar reports about our friends from Taiwan being treated differently with regard to their evacuation plans. I would say in general, however, I think the PRC authorities have generally made good faith efforts to help evacuate folks from Wuhan of other nationalities.
Does anybody have reports about this being in North Korea, which I would assume it is? I mean, do we have any definitive proof?
We don't have any confirmed reports. Yeah.
Okay. Let's see. I think with that, Mr. Chairman, I'm going to yield back, and I appreciate everybody here. I look forward to the questions, and I'm going to gather some more information. So thank you all, and I know working together as you are, we will be prepared for this in the United States, and hopefully we can be the ones that help the other countries the most. Thank you.
Great. Gentleman from Michigan, Mr. Levin's recognized to question the witness for 5 minutes.
Thank you, Mr. Chairman. On Tuesday, Nancy Messonnier, the director of the National Center for Immunization and Respiratory Diseases at the CDC, said this of coronavirus. Ultimately, we expect we will see community spread in the United States. It's not a question of if this will happen, but when this will happen, and how many people in this country will have severe illnesses. But National Economic Council Director Larry Kudlow then said, "We have contained this. I won't say it's airtight, but it's pretty close to airtight," end quote. And also, this is all on Tuesday, President Trump said of the coronavirus in the United States, quote, that it's under control and a, quote, problem that's going to go away. So that was all on the same day. Americans are scared of this situation, and they want to know what's being done to keep them safe. And hearing mixed messages like this within the span of hours isn't reassuring. Dr. Redfield, how can the virus be both a problem that's going away and also not a question of if, but when? What should we be telling our constituents about what to expect?
Thank you very much. I think it's a very, very important question. Right now at this stage, and I've said this and I continue to say it, the risk to the American public is low. We have an aggressive containment strategy that really has worked up to this time, 15 cases in the United States. Until the case that we just had in Sacramento, we hadn't had a new case in 2 weeks. We do believe we're going to continue to see new cases, and we do believe now there may be the initial cluster or occurrence of a community acquisition. Some countries, this has moved very quickly, like we saw in Korea now, where we had more cases in Korea in the last 24 hours than we had in all China.
Right.
We see it in Italy, it's moving fast. Iran, it's moving fast. But other countries have really used a containment and a blended mitigation strategy like Singapore and Hong Kong, and they've really limited the spread after the initial introduction from China. We're of the point of view that we're still in aggressive containment mode, which is dependent on early case recognition, isolation, and contact tracing, that now is going to be looking to identify these community introductions and practice public health to minimize them. But at the same time, we've done this to give us time, and I think what Dr. Messonnier was trying to say, I think it was maybe could have been done much more articulately from what the American public heard, was she was trying to say it's also a good time for us to prepare if we have to go to more mitigation. We're still committed aggressively to get aggressive containment. And I think
yeah, okay, I'm gonna stop it there for a second and give my 2 cents. Well, that's all. When they say that they're still committed to containment, well, that's all they can do. Honestly, they don't have, and then mitigation. Well, Yeah. So we'll see how that just pans out. Because mitigation didn't work too well for any other country where this had an outbreak. And just giving the amount of people that would have traveled from China to, let's say, New York, anywhere in this United States, right? Anywhere in Canada, anywhere in the world, right? And of course, we're seeing these little clusters pop up here and there, you know, South Korea, Italy, like I was saying. And it's only a matter of time before we start seeing, and it's gonna be, by the time we recognize it, really, that it's an outbreak, it'll be really full blown. It will, because it's 3 days lagged information to get a test. It's 72 hours on a good day. On a good day. The Canada Air, or the Air Canada flight that happened on Valentine's Day, they figured that out 8 days later just because there was a backlog at the lab. So they didn't know about the woman who flew from Montreal to BC who was infected about this on Valentine's Day until, 8 days later. And that's not good enough. You know, how many people could she infected in 8 days? You know, on the plane, and then they're going to look for contacts on the plane. Like, come on now, like you can, like, why even bother? Really, like you're just wasting resources there because, you know, even if you were to contact the first immediate people, that's about all you could do. Secondary contacts, you know, you can never go that route. It'd be just like a web of disaster. You know, you couldn't follow that many people because we can't see this, right? We can't see this. And it's moving through our society as we speak, as I speak, as it happens right now. You know, and it's happening. And all of a sudden it's just gonna pop somewhere. And that's how these clusters happen. They just pop up. And it usually happens because they will trace an outbreak source, right? So they trace an outbreak source, but how they do that, and they're not testing for this very much. They're really not. The United States is actually doing the least testing of any country. They really are. And Canada is then, second. But yeah, I don't know. It's a lot, right? Anyways, let's get back into this question period, and I believe this is still about something. I forgot. Let's go.
I want the American public to know at this point that the risk is low. I want them to know.
Oh yeah, that the risk is low. Just so you know, he wants to let you know that the risk is low, because we can't see this, and like unless he's got some crazy ass glasses on his face there, where he can see this magically, just see infected people everywhere. I see infected people. It's possible, maybe. I don't know. I guess anything I believe now, because it's real. It's happening. It is, and as much as we don't want to maybe absorb it to the gravity that it actually is, I mean, like, it's going to shut this world down. It really will. It's just happening, rolling out slowly. It'll just take them, I don't know, maybe a month, 2 months, 2 weeks. We don't know. We really don't know how far this has traveled, and we don't know who's infected, because they do say all the time that it's mostly mild cases. Well, that's actually even scarier, because these mild cases usually aren't symptomatic. They're not feeling that bad. They're still going to work. They're still infecting people. All right. So the risk is low. So just remember that the risk is low.
Know that we are going to start identifying more cases like we did the other day. I'm going to ask them to obviously accelerate their own view of the standard things that we do for flu: hand washing, cough in your sleeve, don't go to work or school if you're sick. And we have launched a larger, for our next level of our multi-layered public health response, is to now institute broad surveillance. And we've initiated it. We're planning over the hopefully the next 4-8 weeks, obviously linked to the supplemental, to actually make our surveillance system for corona the same as flu, nationwide. So we can be, very quickly picking up when there is an introduction in a community, go in and try to stop it. So I think that's our position at this point.
Good. Well, let me quickly ask you one other question in my limited time. I want to ask you to speak about the danger of xenophobia in a situation like this. CNN reported last month on disturbing example from the SARS outbreak when, and quoting them, people of Asian descent were treated like pariahs in the West. There were reports of white people covering their faces in the presence of Asian coworkers and real estate agents who were told not to serve Asian clients, end quote. We saw similar incidents during the H1N1 swine flu outbreak in 2009 and during the 2014 Ebola outbreak. And sadly, I've heard reports of incidents like this around coronavirus. So I'd like you to talk about why it's so important to avoid stereotyping people as carriers of the coronavirus and how incidents.
Okay. This is, that's a nice question and all, and I'm sure it's great, but this isn't about xenophobia. This is about personal protection. I'm sorry, it is. I don't even order out food anymore or go to Tim Hortons and get coffee anymore. I really don't. I don't. I don't. Because yes, I'm a little overcautious. Of course I am. And I really, truly need to be, and I think we all need to be, because we truly don't know where this is right now. Maybe, where will we start? Right here, maybe.
In the presence of pulmonary compromise.
This is something you have a lot more faith in our health system, obviously, than Wuhan or pick any of the other countries that you just listed off.
Yeah, I think we're in a strong position. We have an effective healthcare system. I think, at this stage, if we can continue to do what we're trying, early identification, find these community cases, get our arms around them, I think we can continue to respond. Obviously, if the numbers get to the point that we can't control, then that's a totally different part of game, totally different issue. But right now,
I'll pause you there because my time is about to end. Just to say, I think you mentioned something that is important to realize about this, that our health system has a different starting point than that health system of Wuhan and many other places. Certainly doesn't make us impervious to this, but it's a better starting place to be at. Thank you for your comments.
Thank you, Mr. Mass. The gentlelady from Pennsylvania, Ms. Houlihan's recognized for 5 minutes to question the witness.
Thank you. I'm actually going to start. I know that it's my obligation in some ways to ask complicated questions about policy, but Dr. Redfield, I'd actually like to start and lead off of Mr. Levin's conversation for the human beings who are at home, my kids, my family members, my community, and ask the doctor who you are the 18th director of the Center for Disease Control and Prevention and administrator of the Agency for Toxic Substances and Disease Registry. And in your capacity, could you help me to answer a few questions that I frequently get asked? The first one, they can be any answer. I don't know the answers. I'm just asking on behalf of my community. Should people be afraid? Thank you. Could you turn on your microphone?
No.
Should people engage in regular hand washing and coughing into their sleeves?
absolutely.
Should people be stocking up on cleaning supplies?
No.
Should people be stocking
What?
up on prescription medications
Wait.
that they have?
What?
Not at this time.
Oh my God.
Should people be stocking up on food supply?
Oh my God.
this
They're
time.
gonna watch us burn for. It really feels
Should
like
you
it.
wear a mask if you're healthy?
Oh my
No.
God.
And is there a website, and you can answer this later if you don't know it by heart, where people can go to access good information about these questions?
Absolutely. The CDC,
Oh
cdc.gov,
my
we have
God.
all of the information on that website. Then when
They're not
and
ready.
something can take you to coronavirus and where
And
we
they
are
gotta
and
stick to their
preparedness,
guns, right? They just
all
have
our
to.
recommendations.
And sir, is there anything else that I should have asked you that's a regular, everyday person kind of question?
The one comment I would make, because I do see people feeling a need to go buy masks. And I would ask them, and some people scoff at me when I say this, we need to make sure those N95 masks are available for the doctors and nurses that are going to be taking care of individuals that have this illness.
Yes, that's very important. And that's why they're going off with this directive now that the masks don't work or they're not that effective, because everybody's buying them. And the doctors and nurses don't have them. There's a huge shortage. There really is, like a massive shortage. The dentists can't even. The dentists are like, they're even having a really bad time with this, right? Because they use how many a day, right? They're actually in really short supply. So they're going with the directives that, no, well, they don't really work. Well, I guess neither does a hard hat if you get like hit with a fucking 600-pound fucking bucket on a excavator, but you still have to wear your hard hat on your job site, right? It's still, it's what they call PPE, personal protective equipment, you know. But anyways, now you got the people saying, or these people saying, no, they don't work because, well, it's just really part of their directive to try to not get people to buy them so that their healthcare workers can have them. Well, that's, of course that's legitimate, but it's all the other outbreaks they were saying buy the masks. The masks work. Oh yeah, they're good, they're great. Now this outbreak, no, they don't work because there's an actual big shortage. So we'll keep going with this.
And it really does displease me to find people going out. There's no role for these masks in the community. These masks need to be prioritized for healthcare professionals that, as part of their job, are taking care of individuals and/or individuals who have this virus and are in home isolation or home quarantine for those family members. So I'd like to have prioritize the uses that we recommend and get people to realize that that's where these masks need to be reserved for.
Thank you. I appreciate that. And with the last couple minutes of my questioning, I think this is either for Mr. Fritz or for Dr. Redfield based on how people have answered questions. I'm going to follow up on the line of questioning that has to do with prescription and pharmaceutical supply chains and the integrity of the supply chain. Is there a place, a way that we have historically been tracking various supply chains? In my old business, we would make sure that we had at least 2 or 3 suppliers of the same material just in case. Is there something that we have, a database or other system that tracks those kinds of suppliers and where they are geographically?
Thank you, Congresswoman, for the question. As I mentioned, there is a very intense interagency process underway. I think HHS, in particular, the Food and Drug Administration and other relevant agencies are all looking very carefully at this exact question and making sure that the answer to that question going forward is that we do have access to whatever we need to sustain ourselves in the current outbreak and to make sure that we're ready for future ones.
So I understand that the FDA largely is, sort of lead on this, but is there a role that the State Department can play on this? Is there something that we at this body can do to be helpful in that?
What the State Department is doing is we're looking very closely at the impact of the outbreak on our global supply chains. And of course, we're working with some of our other foreign affairs and trade-related agencies to map that out. And then we're, again, together with HHS and others, looking at how that impacts our ability to access what we need in time of crisis here in the country.
Yeah, and I'm just looking for this to be sort of a sad lessons learned. How can we take this experience and make sure that doesn't happen to us again? How can we make sure we know where our suppliers are and how to make sure that we are safe from this kind of exposure again?
Yes, ma'am. I think this crisis is teaching us that we need to pay very, very close attention to this in the era of globalized supply chains. And we are bound and determined to make sure that whatever lessons are learned from this are applied going forward.
Thank you. And with my last half a minute of conversation, I just wanted to kind of take off on something that we were happy that our healthcare system was better than Wuhan. That's awesome. But can you comment a little bit more about how we need to work with other nations to make sure all of our healthcare systems are working together in tandem on this?
Thank you for that question, ma'am. I would like to point out that U.S. foreign assistance over a number of years now has focused in large part on helping countries around the world build public health systems that are able to be resilient in the face of these sorts of crises. Of course, that is being put to the test in many instances. I think what we can say is things probably would be much worse if it had not been for our efforts over a number of years to share best practices and actually make resources available to build capacity around the world in this aspect. And of course, we have announced up to $100 million of assistance for partners around the world to respond to the COVID-19 crisis.
Thank you. I've run out of time. I yield back.
Thank you, Mr. Lamb. The gentleman from Ohio, Mr. Shabbat's recognized to question the witness for 5 minutes.
Thank you very much, Mr. Chairman. Mr. Fritz, I'll direct my question at you if I can. I was one of the original founding co-chairs of the Congressional Taiwan Caucus, and I'm now one of the co-chairs of that caucus. And as you know, and as we all know, the PRC, China, considers Taiwan a breakaway province. Taiwan, for all intents and purposes, conducts itself as an independent nation, not necessarily recognized by the world as such, but it is, and the people there are free. They ought to be a model to other countries around the globe. They've been bullied by the PRC for many years now. But my question is this: they have sought to be recognized as on observer status, basically, at the WHO for many years. In my view, they ought to be essentially a fully recognized participant in the WHO. It's kind of a gap in our world health system in not recognizing them, not letting them fully participate. But at this point, China has still blocked them from so participating. With something as serious as the coronavirus, and obviously its origins in the PRC, in China, and Taiwan being right next door, and Taiwan having some of the top medical institutions and doctors, medical personnel in the world there, you know, it seems to make no sense that China continues in this effort. Taiwan could be helpful, even more helpful to China. So what gap does this create in the world's response to this very serious medical and the situation we have with the coronavirus? What's the problem with what China is doing relative to Taiwan?
Thank you very much for the question, Congressman. As you said, Taiwan is a robust democracy. It's a model in that respect. It's a reliable partner on public health and a number of other concerns that we share. And it's a force for good in the world. I couldn't agree more. And I think this COVID-19 outbreak only further underlines the unacceptability of Taiwan being excluded from the World Health Organization and the World Health Assembly because the People's Republic of China blocks every attempt for it to do so. As you mentioned, not only has the COVID-19 outbreak affected Taiwan, they have 30-some cases there. And to the extent that they are unable to get timely information from the WHO, that impacts public health on Taiwan. On the other hand, as you pointed out, Taiwan has a lot of expertise, and they have some experience, and in fact, they have their own, epidemiological, track record now dealing with COVID-19. And to the extent that that is not being shared in a complete and timely fashion with other WHO members, clearly that doesn't do anything for the public health of the rest of the international community, which is, of course, why the United States has and continues to push very hard for Taiwan to have meaningful participation in the WHO and to be granted observer status at the World Health Assembly. China, it's worth pointing out that the People's Republic of China was okay with Taiwan being an observer back when a different party was in power in Taiwan. So through 2016, Taiwan did have observer status at the WHO. It's only when the Democratic, the DPP party came into power in 2016 that China began blocking across the board Taiwan participation. And we continue to push back very, very hard against that with as many of our like-minded partners as possible. And I think our argument is only bolstered now by the COVID-19 outbreak. And I would point out that this push by the USG is fully consistent with our U.S. One China policy and, of course, with the Taiwan Relations Act, which governs unofficial relations between the United States and Taiwan.
Thank you very much. My time's almost expired, so let me just reiterate what you said. I agree with all the points that you made. Thank you for that, and I want to thank the administration for continuing to be a friend to Taiwan, and we would encourage it to continue to do so, even step that up. And it's a shame that the PRC, China, allows its intransigence with respect to Taiwan to put not only the people of Taiwan and its own people, but the rest of the world more at risk than we ought to be. So they ought to do the right thing here and allow Taiwan not just to be observer status, but to be a full member of the World Health Organization, the WHO. Thank you very much.
Thank you, Mr. Shabbat. The gentleman from Rhode Island, Mr. Cicilline, is recognized to question the witness for 5 minutes.
Thank you, and Mr. Chairman, I want to thank you for the courtesy in allowing me to participate in this hearing. And thank you to our witnesses for their testimony. Dr. Redfield, I want to ask you kind of to follow up a little bit on Ms. Houlihan's question about the supply chain, because as you have described this potential pandemic becoming really a global challenge, I guess it already is by most estimates, what are we doing to assure that there's a sufficient supply of, medical supplies? You mentioned oxygen. I mean, do we have a coordinating body that's figuring out if this pandemic proceeds in a serious way in this country, that we'll have access to the resources we need, both for the kind of containment you've spoken about and treatment? And is there someone doing that sort of planning?
Yeah, that's not really within what I do at CDC, but I will tell you that the Assistant Secretary for Preparedness and Response, ASPR, is done extensive work, and it was mentioned by Mr. Friss. There's an interagency group that's really going through this in quite detail with the FDA and ASPR in terms of many of the medical issues. But there's a broader intergovernment group doing it in the broader issues. And so I can tell you that's ongoing, and we could obviously get to you who's the leadership on it, but I know ASPR and FDA have done it on the medical side, and there is a broader intergovernmental working group to really get down to all of these issues.
Great. And you also made reference to the Chinese CDC or counterpart. Can you speak a little bit about the relationship between the CDC in the U.S. and the Chinese, particularly as it relates, I'm particularly interested in this healthcare worker transmission. 2 weeks ago, China reported 1,700 healthcare workers had been infected by coronavirus, and just wondering what we're learning about that transmission and whether or not that's informing protocols here in this country to protect our healthcare workers.
Yes, thank you. The CDC has had now over a 30-year working relationship with China CDC. There's a reason they call it China CDC. And I actually have a U.S. CDC component that's affiliated with the embassy, but is attached to the China CDC. The head of CDC China and I have been in regular discussions since the very beginning when this happened on New Year's Eve, and had very open scientific discussions about what he knew at the time, what he was learning, so we could use that information. And that continues bidirectionally, as I say. From at the beginning, there was not a thought that there was human-to-human transmission and nosocomial transmission. They saw that, in the first week, they didn't see any in the second week. But remember, they were using, a definition of whether people were very severely ill. They weren't recognizing that this could be mildly symptomatic. Since then, there's obviously been extensive hospital-based transmission. And one series that was published in one of our journals in JAMA recently showed that up to 40% of the cases got infected either because they were healthcare workers or because they went into a hospital where they were infected after they got there. So healthcare transmission is really a high risk, particularly in areas that really aren't vigilant in the importance of infection control. We're happy to say to date, we haven't had a healthcare worker. Obviously, the new case, as was mentioned by the chairman, raises concern because people were intubated and not necessarily in precaution, so we're aggressively evaluating that healthcare setting.
And Dr. Redfield, could you just give us a quick update on the vaccine development status and whether or not additional resources are necessary, what the timetable looks like for that? I think lots of people are interested in that.
Sure. Well, the NIH, Dr. Fauci, has the lead on this, but I can tell you what he's told us and others is that they do have a candidate product that they are planning to move into a phase 1 trial, hopefully in the next 6 weeks, which will evaluate immunogenicity and safety, assuming that candidate, and they've partnered already with a private sector company, and assuming that goes well, then they would move into an expanded phase 2 trial. But in reality, if everything goes really well and they get the strategic partners that they need, he's saying he looks at a year to 18 months before we could have it. We do believe scientifically that this is a virus that should be able to have a successful vaccine based on the coronavirus, as opposed to if we were trying to do this, say, for HIV. You know, we would say, well, we don't know because we're not sure how that's going to work or not. But for this virus, there's a lot of scientific reason to think that it will be successful. And the NIH is really moving forward very aggressively to try to make that happen.
Thank you very much, Dr. Thank you, Mr. Chairman.
But yeah, he said a year to 18 months there, in case you missed that, because he did say that really quick and then shadowed it with, you know, a bunch of positive information really quick. But yeah, a year to 18 months for a vaccine for this, for human, for, you know, for distribution. Do we have that time? I don't even think we have a month. I really don't. I think in less than a month, it's just going to be wildfire across the planet. It actually is right now, but, well, we just don't see it because we're not detecting it. You know, it's very hard to detect this because people don't show symptoms. It's very sneaky. It really, really, really is. And most people just are not going to take awareness to it, or the amount that they should, I guess, until it happens. Yeah. But anyway, we're going to finish up. There's a couple of more questions coming up in here, and it's really decent. They do grill them quite hard, and if you're looking for information, here's where it is. You know what I mean? This is from the United States, but this is, you know, this is a testimonial, right? So they got to be pretty honest as best as they can. And yeah, David Sink, yeah, man, pretty selfish to run stockpile up on masks. Yeah, it is. Yeah, if you're hoarding like a ridiculous amount, well, yeah, that's a little selfish, of course. But you know, if you're getting some for personal safety and to protect your family, you know, or whatever, you know, that's just common. You're gonna do that. At the same time, you know, it's you know, is it even going to be enough, right? You know, we're dedicating everything to the front line. Well, you know, it might not even be 1% of what they need, right? So it's obviously going to help, but you know, it's personal safety as well, right? We got to take into our families into account. You know, what if this thing does go crazy out of control and you have to go out sometime, you know, but like there's a lot of people dead around you, and you know, you'd want to have a mask, I'm sure. I don't think you'd be worrying about your healthcare professionals at that moment. If it came to that, right? Yes, you know, I see the value in, you know, helping and doing good things, and you know, but at the same time, overdoing it is not good. But you know, being conservative and getting stuff for your safety, yeah, that's definitely advisable, 100%. But yeah, you know, you can obviously go overboard, and that's what a lot of the fights happened in China, because people were taking too much, and you know, at the grocery stores they were loading up on stuff, and people were like, "Fuck, you can't take that much," and they were like fighting people for it, and like, you know, share some with other people, and yeah, it was messy. But anyway, we can only take an example from that, and it was not only China, but it was everywhere else that had an outbreak. Italy, South Korea, Iran, Japan, the UK now, like, you know, the Pope has, well, possibly has coronavirus, and yeah, he really does. He's sick, and they're would they tell us? Who knows? Maybe. I mean, I think the world would pay attention if the Pope got the coronavirus. You know, think? I don't know, maybe not. But anyway, let's keep going. And there's some good points coming up here.
Yield back.
The gentlelady from Virginia, Ms. Spanberger, is recognized for 5 minutes.
Thank you very much. Thank you to the witnesses for being here. And as you might imagine, I am very concerned about this, the issue of this virus, and constituents across Central Virginia, the district I represent, are deeply concerned. So I want to start by saying thank you, Dr. Redfield, for what you said to my colleague, Representative Houlihan, which is that they shouldn't be afraid. I think that's incredibly important. I appreciate you being here today to talk about this important issue, but also to mention that, because so much of how we are handling this, this disease, this outbreak, will also be determined by how we're communicating and what the temperament and feeling on the ground is. I wanted to speak very briefly about some local preparedness. And Dr. Redfield, I'll start with you. The coronavirus is expected to put additional strain on our healthcare system, and you've noted that our healthcare providers are already at near max capacity due to a bad flu season. How is the federal government ensuring that medical providers across the country have what they need and the resources that they need, and what else could we be doing?
I'll just pause it right there again for 1 second. And they said, you know, the healthcare systems in the United States are like pretty well capacity right now. Right now, like their capacity. Because already of, they're saying, you know, a very bad flu season. And this virus is in of itself behaves just like the flu. The same symptoms. Be really hard to distinguish that, wouldn't it? You know, really bad flu season, trying to figure out, you know, you couldn't test every person that come in the door, but, you know, because we just don't have the testing capacity to do that. We really don't. Not even for one full state. You know, it's tough, right? It's tough. So, yeah, you got to really consider this, that we're not catching this. We're not catching the amount of cases we think we are. Not even close. Because, you know, it's a hard thing to differentiate between the flu and this, because it has the exact same symptoms almost. And then it's a 3-day test to find out if you have it. You know, you could have infected people at the hospital if you were infected. You know, we don't know. You know, it's tough. I'll tell you, logistically and from a medical standpoint, to try and catch this, and we're missing like, I would say 90% of the cases. I would, or more. But anyway, I think it's a lot. But here comes the serious questions. There's another question period after this one, but again, you know, the hospitals are at capacity, and let's see what their answers are on how to handle that.
A very important question, and I want to say that my partnership agency in the Health and Human Services, ASPR, has been working and continues to work to see that hospitals begin to get prepared. That's one of their essential missions to the Assistant Secretary for Response and Preparedness, ASPR. And so they are going through that in great detail. They've had dialogues with different hospital corporations, just hospital leaders, to begin to see that. Because you do say that this, you know, for us, there's not a lot of flex in our health system right now. I mean, most hospitals right now, because of influenza, if you're looking at them, they may be at 95, 96, 97% capacity. This is why I stress that our current public health response, that multi-layered response, is containment, 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 to try to buy us time for, you know, the fruits of labors by NIH and Dr. Fauci and the private sector. So hopefully in the not too distant future, in a year and a half, 2 years, we'll have a vaccine. But I can tell you ASPR is very aggressively working and evaluating this, and the term they use is resilience, to try to make sure they can build resilience into the system.
And following up on that notion of containment, in order to contain, we need to identify it. And in your written testimony, you noted the importance of using illness surveillance systems. Can you tell us a bit more about how we are applying existing systems to this virus, and are U.S. public health agencies developing new surveillance, illness surveillance systems specific to coronavirus?
Yeah, this is really important. This is really one of the most important components from CDC's perspective in the recently requested supplemental. We have an excellent surveillance system in this nation for flu. We have multiple surveillance systems, as you just mentioned. We have the illness, we have multiple. And rather than recreate the wheel, what we have proposed, and we've actually begun this, at least initiate it, is we're really adapting our entire respiratory disease surveillance systems and now interfacing coronavirus 19. And, you know, I'm very hopeful in the next 8, 12 weeks, we will be in a position that we will have your flu surveillance system, if you follow that, and you're going to have your national coronavirus system. I'm more interested in this, as I'm hoping is the canary in the minefield, in the mines, that I can see when and if we're getting community. I don't have to wait till an individual gets hospitalized and is on a ventilator. You know, I have to be honest with you, we don't know what we're going to find when we start this, but we're very anxious to get this broad coronavirus surveillance system using all the systems that we have right now for respiratory disease and get that operational as soon as possible.
And to be able to see the trends that we may be seeing that in fact demonstrate that we're looking at potentially an outbreak in a locality or in a state.
Absolutely, and then be able to put the full power of the public health approach of case recognition, isolation, contact tracing to try to make sure that that cluster is contained.
And do you have the financial resources and the employee capacity for this surveillance system and what you need into the future?
Well, I will say that's one of our major components of the supplemental that was put forward, was to be able for us to roll this out nationally.
Great. Thank you so much. To the other witnesses, I know I concentrated my question on Dr. Redfield, but I do appreciate your time and your presence here today. Thank you. I yield back.
Thank you, Ms. Spanberger. The gentleman from California, Mr. Liu, is recognized to question the witness for 5 minutes.
Thank you, Chairman Barra, for calling this important hearing. Thank you, Dr. Redfield, for your public service, including your service to the U.S. military. The Washington Post published an article. Headline is, "A faulty CDC coronavirus test delays monitoring of diseases spread." So my first question to you is, does the CDC's test for coronavirus work?
Yes.
Okay, what is the error rate on that test?
So we created a test really very rapidly based on the sequence of the virus, within really a week of the sequence being published. And it's a PCR-based test. And the way it was designed at CDC was it actually measures 3 different, if you will, components.
I just need to know the error rate.
Well,
if you know it.
Yeah, the problem was when the test was sent to the states, one of the components had a contaminant in it. That's what had to be corrected. The test at CDC works fine. When it was given to a manufacturer to scale up for the states.
Has the CDC fixed it?
It has been corrected, and there are tests that are being shipped out as we speak.
Okay, so in fact, the first test didn't work.
First test works because it was developed at CDC, and it works fine. We test everyone in the country. When the manufacturer scaled to send to the states, when the states got it, it could tell positives, it could tell negatives, but because of one of the contaminants in the control, there was another group that was, we don't know if it's positive or negative. It was inconclusive. And at that time, the FDA requested that we not use that test and have people send it to CDC, where the initial lots that we made were quite functional and there was no contaminant, and that's the test we continue to use today. There are now over...
All right, so I just need it. So the current test works?
Current test works.
Okay, great. So it's been reported now that 48 countries have coronavirus cases. In Italy, it's skyrocketed now to 650 cases. South Korea has now 1,700 cases. As you yourself stated, there are more new cases in South Korea than in China. Why is it that we're only testing people who have traveled to China? That seems to make not a lot of sense to me.
Well, when this outbreak originally occurred...
I'm talking about right now, not when it occurred. Right now, why aren't we testing people who have traveled to South Korea, traveled to Italy, traveled to the 11 European countries where there are now coronavirus cases?
We're continuing the travel restrictions that were initiated.
No, I'm just talking about testing people. Why don't you expand the test? Because there's a person in Northern California that doctors recommended get the test. And CDC said no, because the person had to travel to China. That's just really stupid, because we know this has expanded way beyond China. 48 countries, every continent except Antarctica has these cases. We really should be testing people, not just those that have traveled to China. Can you commit to expanding the test to beyond those that have just traveled to China if they have the symptoms that look like they have coronavirus?
Congressman, I mentioned earlier, I think before you were here, just so you know, We initially had a geographic restriction. We have changed that. We've posted there's a no geographic restriction, that if a clinician or a health department official considers the coronavirus in the differential diagnosis, that now meets our criteria.
When did you make that change?
We made that, well, yesterday we did it and we posted it today.
Thank you for making that change. Okay. So in terms of transmission, because earlier you said people shouldn't be afraid. My understanding, based on the articles, Reuters reported that coronavirus contagion rate makes it hard to control. And there are these two scientific studies that show essentially each person infected with coronavirus is passing the disease on to between 2 and 3 other people on average at current transmission rates. And then if you've got this long incubation period, potentially 14 days or more, you could have an exponential explosion of cases rather quickly, such as in Italy. Isn't that correct?
I think we've seen that obviously in Italy, Korea, and Iran, and yet.
All right, so this person in Northern California who didn't travel to China, where we don't know where he got the coronavirus, he could have passed on to 2 more people, who passed it on to 2 more people, who passed it on to 2 more people. So there could be a whole cluster of cases, but until as of yesterday, we don't know because we weren't testing anyone who didn't travel to China. Am I understanding this correctly?
The current public health evaluation of the case in the chairman's district is being led by the state public health system of California, and we're supporting it. We have a large number of contacts that have been evaluated, that are being isolated, that are being tested to really look at the fullest extent of the potential transmission around that case.
Thank you. I'm going to conclude by saying Donald Trump has attempted to minimize the coronavirus outbreak. There's an article in the Daily Beast titled Coronavirus May Explode in the U.S. Overnight, just like in Italy. I request that when the data and science contradicts what Donald Trump says, that you follow the data and the science. I yield back.
Yeah, I can just say that I commit that CDC is science-based, data-driven service organization, and that's one of the prides that I have to be the director now, to be in a science-based, data-driven, but most importantly, service organization.
Thank you.
Let me recognize the gentleman from California, Mr. Sherman.
Thank you. China failed to, well, actually hid this disease at the beginning. China continues to they try to exclude Taiwan from the WHO. There are a number of things China could be doing. We need Chinese cooperation to start clinical trials. Dr. Redfield, are we getting it?
There is a drug called remdesivir that's now in clinical trials in China and Japan, and it's been extended, there's actually to the United States, to the repatriated individuals.
There's similarities, vague similarities to the flu. This flu is often seasonal. Is this, our president has said, oh, it's going to be gone by April. How confident are we that transmission will be substantially less when the winter is over?
It's unknown.
There are various treatments that are used for flu, such as Theraflu. Is there any reason to think that there's some chance that that would be helpful in reducing the effect of the disease?
Not for the coronavirus 19.
And likewise, the SARS vaccine, would that provide any protection?
It's unlikely that the cross-reactive, but the methods that they were used to develop that vaccine is the reason that Dr. Fauci's been able to accelerate the vaccine he's developing.
Good. And what's the earliest we could have a vaccine?
Well, Dr. Fauci has said one year to 18 months if everything goes well.
Gotcha. Let's see. How well are we cooperating with China today? Are they providing the information we need, and are our people on the ground? Mr. Fritz.
Thank you, Congressman. I pointed out a bit earlier that we did get we got good faith cooperation from Chinese officials as we worked to send in and get out our 5 plane loads of evacuees.
I'm not talking about, yeah, but
Sir,
We have people on the ground at the epicenter of this epidemic getting information that's helping Dr. Redfield do his job.
I'll defer to my
Okay, now,
CDC
Dr.
colleague on the
Redfield, yes.
actual.
Are you getting what you need from China?
I have regular discussions with my counterpart, George Shao, as the head of CDC. We do have a CDC, a CDC that's embedded into the China CDC, so we are having daily interactions. I have a team of respiratory experts that are there, working there. At a scientific level, we're having good dialogue.
Congressman, if I could, I would point out that Secretary Pompeo and others have also, of course, made it clear that China's allergy to freedom of speech, freedom of expression, et cetera,
Well, yes,
have been obviously had a very negative impact on
The
the
initial
ability of Beijing
response
to-
of local officials was to try to keep it under wraps, and the failure to be a free society. That's why this thing got going, and we're now in a position that perhaps could have been avoided if China had a different policy toward free expression.
I like this Mr. Sherman fella. I really do. He's one of the few people, and of course the last questioner, for sure. People are calling it out now because they don't trust it, and people feel that they're dropping the ball on this, and I firmly believe that, and it was happening since day one. But the biggest thing here is to, not panic the public, but at the same time, in order to not panic the public, you must be hiding or bending some truth somewhere. Of course, it would have to be, right? So, anyways, thumbs up, 2 thumbs up for Mr. Sherman. Let's just keep going.
Versus hide things and hope that you can keep them under wraps. Let's see. Why does the administration request for additional funding rely overwhelmingly on transferring funds from other disease-fighting accounts? Dr. Redfield, do we need to spend any money on Ebola? Can we just grab that money? No problem, though?
Obviously, we have an ongoing Ebola outbreak right now in the Congo. I really can't.
Do you think it's wise then to take all the money that we had appropriated for Ebola and not spend any money on Ebola?
I really can't comment on the budgetary decisions that were made.
Are you doing useful work that will save lives or may save lives with regard to Ebola? Are you, if we leave the money in the budget, will you spend it effectively in ways that help save lives?
We currently have an ongoing Ebola outbreak in the eastern DRC where we have a substantial number of CDC people deployed. And we are, if you will, and I say this and knock on wood, we're finally close to winning, okay? We're down to, really, in the last week, we didn't have a single case. So we now project, based on our models, that we might actually end this outbreak by the end of June. But obviously, when instability happens again, we could be right back where we were 2 months ago. So,
and if this Ebola outbreak expands in the eastern Congo, it could be a threat to the United States, just as a Chinese epicentered problem has been a threat to the United States and even to California.
well, we've been fortunate with Ebola in that there's very little movement from the Ebola eastern Congo, where this outbreak is, and the United States. But we obviously have had to invest significantly in what we call exit screening from the Congo as we've dealt this. As you know, we've been in this outbreak now. We're almost about to start the 3rd year.
But if we don't fight Ebola in Africa, does that mean Americans are safe and everything's fine, and you're assuring me that we can just not worry about Ebola and we're not going to have a problem this year or next year?
I think one of the most important things our nation can do is build a robust global health security capacity, all right, so that we can detect, prevent, and respond to these outbreaks at their source. And this is exactly what we're doing with Ebola. The more that we can expand that capacity, and I believe strongly it's a core mission of CDC, we're the tip of the spear to identify these infectious disease threats. And obviously, we appreciate your continued support in that regard, because what we're seeing with the coronavirus is just another example of why it's so important that we have global leadership in the ability to detect, prevent, and respond to these outbreaks.
I would just comment that the outbreak of this coronavirus demonstrates the importance of your work and the absolute folly of pulling the plug on some of your work because of an unwillingness to fund the additional work that we need to do for the coronavirus. With that, I'll yield back.
Thank you. I'm going to use the chairman's prerogative to ask a couple questions because I feel bad, Mr. Brownlee, Dr. Walters. I appreciate your coming down and seeing. I don't know if I'm doing a favor asking you questions or if the goal as witnesses is to slide out of here with no questions. But I appreciate your coming down. Mr. Brownlee.
Yeah, we're just gonna leave it at that because they don't really go into a whole lot more. Actually, let me see here. Maybe we will actually start right here.
The ranking member had additional questions.
Yeah, and that's for State Department, because we heard over in China how I think it was 1,600 health workers came down and they were sick. We had talked to our ambassador from Cambodia. We had a discussion with him today, and he was saying what a stellar response our State Department did of working 24/7 at 6 different locations, moving people out. What kind of protections do we have for our State Department personnel? Because I know when we go on Codell's, you guys work your tails off, and we appreciate it. And we want to make sure you have the coverage and the health care that you need. You feel adequate?
Yes, sir. Thank you for the comments and the question. Here's what I would say. This is an international emergency with significant domestic risk. But in 220 locations around the world, we have a workforce of 75,000 people, some of whom are in countries that have active cases. Others are in countries that may tomorrow find themselves with active cases. We learned our lessons in 2004. We learned our lessons again in 14, 15. And we're thankful to Congress for the support we've had in the preparedness side of this. There is PPE at every embassy. Our healthcare workers, a workforce of almost 700 in all these locations, are well educated. They are well prepared. We continue to look at our resource requirements, and we continue to look at our authorities, not just to take care of American citizens, to the chief of mission personnel, but really in that global picture to protect Americans.
And we feel confident that if an embassy were to come down and the workers get exposed, that we can get the supplies needed in there. If it's in an area that is more remote where we don't normally have good health care, maybe that we can get it in there in sufficient numbers. We feel like we're protected there, right?
So there's 2 parts to that answer. The first part is the same aviation contract that made these evacuations possible is the same aviation contract that makes delivery of critical supplies possible. The second part to that is actually a greater risk. And the greater risk here is when you look at the way we do medical evacuations of chief of mission personnel around the world, they don't typically come back to the United States. They go to medevac centers with established relationships in South Africa or the UK. Those countries are now making it more and more difficult in a way that you can understand to bring non-UK citizens or non-South African citizens in if there's any risk that they have COVID-19. So we continue to work with our international partners to keep those diplomatic platforms open so that Dr. Redfield's teams have a place to work and the resources and relationships to do it, but still be able to medevac our chief of mission people home when the time comes.
Okay, thank you. Dr. Redfield, again, there's this cloud of lack of transparency that we keep getting from China. What signals can we see from China to see what the real extent of damage is behind the containment? The National People's Congress meeting has recently been canceled. I mean, that's a pretty strong signal to show that that threat is they're really that concerned about it, as they should be. But then with the people over there not getting, an open press where they can get reliable information, do we feel like they're being forthright with you? I mean, you're working with them on more of a scientific platform. Do you feel comfortable with the information you're getting?
From my colleagues, the scientific interaction we're having with our CDC colleagues and from the China CDC, I'm very comfortable with it. What we have, as I said, I have my own director of the American CDC in China. They're regularly interacting. So at the scientific level, we're having collaboration. I really can't really comment beyond that. I will say it's worth noting that they've probably introduced some of the most aggressive containment mitigation strategies that we've ever seen on the planet, in the history of the world. You know, but and I would like to say, just though people are feeling better that there's a reduced number of cases in China. Just last night,
If that's accurately reported.
if accurately put, but even then, it was 434 people, and over somewhere between 25 and 30 deaths last night. So they still have a major problem despite everything they've done in mitigation.
I want to throw one thing out, and I don't really expect an answer on this. Being a veterinarian, we've seen the porcine viral diarrhea syndrome broke out several years ago. Within a year, it was in America, lost about 300,000 sows in America. African swine fever broke out, I think it was May of 2018. I can't remember the exact date. We've not seen that here, but we do know this. It is a very hardy virus that can be transmitted in different fomites. It can resist freezing, it can resist heat, and it can make the shipping from China to the United States in containers in different materials, whether it's feed, packaging. And so this is something we need to be alert through APHIS, through USDA, through CDC, that we're monitoring these things better than we ever have before, because that's a port of entry that we might not even be looking about. We're looking at people, but we also need to look at containers and fomites coming in that way.
Yeah, the only comment I would make for this virus, just so you know, we are aggressively evaluating how long this virus can survive and be infectious. And where on copper and steel, it's pretty typical. It's really pretty much about 2 hours. But I will say that on other surfaces, cardboard or plastic, it's longer. And so we are looking at this because we don't know the role of fomite transmission. Now, I don't think it's going to impact cargo, okay, unlike maybe some of the other viruses that you've talked about. But I do think that it may have contributed to the huge outbreak we saw on that diamond.
But he's just saying, I do think, or, you know, like they don't know, you know. Anyways, we'll leave it there. That's really important information. I'm kind of a skeptic. And these people in the panel, you know, grilling the CDC are skeptical as well, of course, and rightfully so, because they do represent the other side, the skeptical side, you know, and I like their side, because not many people are taking this as serious as we should. You know, like Quebec has its first case. You know, it's only a matter of time. Like if they found a case, you know, it's only a matter of time, right? It's like we're doing pretty good, and we might be able to stop the slow of it because, you know, we got such a high alert right now. But can we stop it? You know, like we might be able to slow it, but can we stop it? Like stopping it is another question. And you know, like he was saying there in that interview, you know, about animals. Well, now, you know, there is a patient whose dog tested positive for the virus. Yeah. Oh yeah, and it's repeated again here. You know, Hong Kong finds traces of COVID in dogs. And like, I guess it's possible. It is. And we got to be looking at this worst case scenario right now. Like, I mean, worst case scenario. Which means, you know, what does that mean? Well, yeah, that's what I mean. And I'm not even kidding, because we don't even think that that's possible, right? We look at it in movies, and we look at it, you know, most of our media, mostly all the stuff in the past has just turned out to be bullshit, you know. But we've never seen any countries locking down like this. You know, China, like, we never even seen one city locked down before over a virus, ever. But then we got one city, and then there was 16, and then there was 52, and then there was the whole country of China, and now it's Italy, and now it's South Korea, and now it's Iran, and now it's Kuwait, and now it's and you know, Montreal's got a case, Canada's got a few cases, US has got a few cases, everybody's got a few cases. We're just going to see this pop up, and when it does, it's going to overwhelm the system. like they said in that broadcast, right? The healthcare is at 96 or 98% capacity in the United States and Canada. It'd be the same thing. Like our healthcare is pretty strapped as well. You know, it is. Frontline staff are obviously going to be really sketchy about this, and keeping them on to do it might be another issue as well. You know, Japan, a lot of the healthcare workers just walked off the job because they just were like, no. And you know, like if somebody gets an outbreak at a hospital, and you're, you know, a nurse or a healthcare worker there, would you stay? Given the knowledge that you know and the protection that you have, are you satisfied with that? You know, would you be satisfied with what we're currently doing for our containment measures? Of course. Do you feel safe? You know, it's a question for sure, and you bet they're going to be asking it, right? Of course, because we've seen, and they mentioned it in the past broadcast as well, or the testimony, the CDC, that they where did my train of thought go? Yeah. Anyway, worst case scenario. Yeah, worst case scenario. I totally lost train of thought there. I smoke a lot of weed. But I'm trying to get the message out to people, right? And that's just the way it is, right? And it comes out the way it comes out. And if you can at least take some precautions and be aware, maybe because of what I'm saying, maybe because of what somebody else is saying, maybe because it's an amalgamation of what everybody's saying, you know, it's maybe not just me. Like, go out and do your, let's just see, you know, this here, the CDC is your goatee, CDC approved. Well, is it? You know, like, it's going to be real for some people if they have to shave their beard, you know, put on a mask. Yeah, we're going to find out. You know, this here's probably the way to go. Full shield, 100%, because you can get infected through the eyes, right? Unless you want to go with not that one, but like something like this. Different cartridges for different stuff, but you would obviously, if it's safe for like asbestos, basically you're good to go. No worries. So yeah, and N95, the P5, yeah, it just means 95% particles, right? Particle capture is 95%, and there's 100 ones, but they're super hard to breathe out of. You wouldn't really want to get one. You'd be, you know, if you were doing anything at all, you'd have to take it off because you just wouldn't be able to breathe through it. It's quite difficult to breathe through it. Quite uncomfortable. So yeah, the 95s are good. Yeah, it's real. It's happening. It's here. It's coming. It's, you know, it's just a matter of time, or we get a lockdown or a quarantine somewhere, right? Quarantining Canadian city over coronavirus would be illegal. Well, I'm glad that works. You know, fuck you, I'm not listening. I'm just gonna go to work and I'm just gonna keep. Well, oops, I got it. God damn it. Yeah, you know, you gotta be careful. Seriously, and you get it. You don't know. Like, we don't know if you can actually get over this. They're saying that, but they really don't know. It's totally unprecedented public health. It reminds me of what we might see in the movies. Honestly, I'm gonna tell you, like, this is going to be a shit show level event. I'm just telling you, that's the way it's gonna be. We're gonna see commodities and medications and all that kind of go first. You know, we might be able to support it for a little while, but how long, right? It would basically have to go back to living off the grid, in a sense, I think, because we don't know. We don't know if this is going to be a seasonal thing, if it's going to stay around. There's so many questions, but you'd want to. This is bad news, right? And people just don't understand it, how bad it is. Like it is. A cabin in the woods might be the best option. And a fishing spot. You know, live off fish and do some hunting, get some rabbits. Actually, I don't know. They might be coronavirus rabbits. You never know. Obviously, they did say it could possibly infect animals, right? So it's you got to think of that. It could affect the wildlife. It's crazy, right? The science behind it is kind of wacky, saying some very disturbing things. You know, and they're trying to keep the public calm. Of course, that's their job, right? Yeah, people are shedding the virus before they are sick. Yeah, that's terrible, right? You can't contain them. You can't contain this now. We can't. It's already out of control. We should have been doing like really level 5 lockdowns or whatever the hell you want to call it, maximum lockdowns like a month ago. But nobody really understood it, or so they say. They didn't understand it, and then they just kept rolling it out. It just kept spreading and spreading and spreading. And now people coming from Iran are testing positive. Like almost everybody that comes from Iran is positive with this. That's where the new Canadian woman was. She flew from Iran. The new case from Canada and Quebec. Quebec has its first probable case coronavirus. You know, and this is, you know, she flew back from Iran. So Iran must have some hell of an outbreak. I'd say North Korea does too, because they don't even barely have a healthcare system, and quarantining this wouldn't do anything. I don't think. Kim Jong-un shot executed one of his top officials because he broke the quarantine virus rules or something. Yeah, he shot him execution style in front of like a bunch of people. Set an example, you know, don't break the coronavirus rules. But everybody was kind of just in a big group gathering, so it made no sense at all, right? Obviously, you know, it'd just be contracting if they're in a group setting. So, but everybody gathered to watch him execute this guy because, whatever, I don't know, broke the rules, I guess, for the coronavirus. Yeah, South Korea has, you know, actually, let's go check some numbers. Where are we going to check some numbers? Maybe over here? It's like that, the one. Now, these are official. These are the ones that we know. What about the ones that like, wow, in 7 days? Italy is like another hospital. Wow, look at the dots over here now, right? It's only, wow. Europe's, oh my God. It's so bad, eh? It really is. Fuck, that's spreading like mad. And Canada's not really seeing so much, but it's just a delayed reaction. It's a latent period with this, right? Because it's like 14 plus days that you can like not even show symptoms but still be infecting people. Like you could be completely fine, you know, but you took a trip to wherever and you caught something off somebody and you went back to work and you went, you know, and you're infecting everybody. And we just don't know because it takes so long for this thing. Oh, it's so secretive, or it's so elusive. But that's, yeah. I remember when it was just China that had a dot. Like it'll just be like a big fucking red dot eventually. Confirmed, 1 recovered, 1 existing. So they got 2 confirmed and another one possibly. Recovered, well, we're still not 100% sure about that yet. Another one confirmed there. Another one confirmed there, and 1 recovered. So 1 confirmed, 1 recovered still means they have 2 cases there. So they got 4 in San Bernardino. What? Yep. 2 and 1, so they still got 4 in Santa Clara, Yeah, they got 8 right in this little spot right here, right? It's going to pop in San Francisco. And they did declare a state of emergency, actually, in San Francisco like 2 days or 3 days ago. But said, it's don't worry, we're just declaring a state of emergency because, it doesn't matter. That's basically what they told the people. They said, don't worry, it's just so we can get our resources going. Canada doesn't have to declare a state of emergency to enact any special protocols. So we won't see a state of emergency in Canada, I don't think, unless it's like a for the whole country, which I don't know. I don't know how they're going to do that, but they did say that Canada doesn't have to issue state of emergency. Toronto, 5 confirmed in Toronto. Wow, 8. That Toronto's going to like existing and 5, and 2 recovered, so that's 8, 9. Yeah, that's not good. I think that's 8 in there, right? And Montreal, 1 suspected, 1 confirmed. Oh, they got 1 confirmed, and there's 2 in Montreal right now. Oh, we gotta go get some news. Let's go get some news. Because this is where you gotta watch it, right? If Montreal starts going into riots, places like big cities start going into riots, and you're not gonna know. Like, you could just be eating your supper, driving to work, or anything, and shit could be melting down country or a few cities from you, right? That would be you'd want to know that, right? So it's good to be aware. And again, my broadcast trying to give something. So first presumptive case, Quebec has. So I guess it's only 1 then. Oh, that's weird. 1 confirmed, 1 existing. So there's 1 I don't get that. They're like, it's so confusing. Reports first presumptive. What you need to know. Yeah, maybe they don't have a second one there because it doesn't really say anything about Montreal Gazette. Let's see what that one is. 2 hours ago was updated. Quebec health officials, disclosed the province's first possible case. Patient is a Montreal area woman just returned from a trip via Iran from Qatar on Monday. Yeah. And then she went to the medical clinic on Tuesday. So she came home on a trip on a plane, right? Possibly infected people on that plane. Of course, it would only be logical, right? Did she infect somebody? Did she go anywhere? Did she meet anybody? What did she touch? Did she touch a payphone somewhere? Did she? Well, I guess nobody uses payphones anymore, but door handle. Somewhere in a bathroom, plane railing, getting down the plane railing, she could have touched the railings, like all the people going down touching the railing. It's so easily spread. And I mean, it's viciously infectious. Beyond, the science is proving that this thing is out of control. This virus itself, not just the infection of the virus around the globe, but the virus itself is just batshit crazy. Its infectabilities are, quite curious. And it's a highly debated thing right now. But we got to be careful what we say. You say it's a laboratory virus that's going to instantly create global panic, instantly, right? In a flash. It's just how it would happen. So they can't really come out and say that. A lot of scientists are pointing at this information, but that's good that Quebec doesn't have 2 cases, but I'm sure there's lots more than just those 1 cases, that 1 case in Quebec or anywhere. Right, my message. It's everybody's gonna. I can't give anybody advice because everybody's gonna be in a different category, right? But there's Ready Marine Corps Emergency Preparedness Program down. We went through this earlier, but obviously no more supplies. obviously the stores are closed. Well, you just loot the stores anyway. Schools would be shut down. Commerce would cease. Yes, of course. Gas might be gone, but it'd be quarantined. It's a viral situation. I don't think too many people are going to be probably driving too far. Cell phone, maybe, but all kinds of stuff could happen, right? If in fact the grid goes down, right? And the insider, Business Insider, you know, this is from the Business Insider. It was like, yeah, you know, first aid kit, of course. You know, they say global catastrophes or apocalypses are extremely unlikely to occur, unlikely in our lifetimes. So that's why nobody's taking this as serious as they should, because nobody's thinking that this could be it. And I really think that this is it. Like, I mean it. No joke. I don't think we're gonna see the sunshine for a while. You know, depending where you're at. You know, if you're off the grid and you're doing your own thing, fuck, you're good. You know, you're it's a dream vacation, right? Go into the woods and just live and fuck off. Live off the land, right? A lot of people might enjoy that. It's like a big fishing trip. You know, and modern cities would be the worst place to be. You know, big cities would be the worst place you'd want to be in if things went down, right? Because if they start rolling in there with quarantine trucks, most people aren't gonna, like, yeah, I don't know. It's the United States and Canada. Like, the United States depends where they roll in at. Of course, but you know, the uprising of people or whatever, you know, how depending how the quarantine is gonna go. But it could turn into a very dicey situation, right? It really could. And you have to be aware of that, and you have to be safe, and you have to be prepared, because nobody's gonna come and save you. not trying to freaking people out, but if our front line goes down, right? If all our medicals, you know, like stuff, you know, these people are gonna be really busy. You know, they're not. I don't think you're gonna want to go to the hospital even if you had a broken leg. Right? So be careful. Like, every step is very vital right now. Don't be dumb. You know, it's almost back to square one. You know, we're still gonna have, you know, resources, of course, that we can gather. In the meantime, but you know, it's gonna get dicey, and that's just the truth. And I feel like that's where it's going. I really do. And most people don't want to believe that, because it's like, well, it just couldn't happen in our lifetime. And no, it's not that bad until you realize it's that bad, and then, yeah. But, you know, it's of course a mind game too, right? It's a mind game, and you gotta be ready. You gotta be able to take this and roll with it. And that being said, stay safe. I'm gonna actually just roll this here as a long broadcast. I've done longer ones actually. But yeah, thanks for watching, you guys, sticking around, and 100%. It's
Cardboard or plastic.
Okay, yeah, and oh yeah, that's another good thing. Be careful what you buy. Make sure it's not imported. I went shopping with gloves on. Do you think I'm foolish? I do too. I'll admit it. I did. I thought I was foolish. So, with that, you know, share this. Share. No, Jody, no, it's definitely not selfish to buy a couple of masks for yourself. Hell no. No, and you know what I mean? It's about being, I guess, you know, more, it has to go to a community-based level on this, you know, and people have to pull together. Of course, there's going to be hoarders, but you know, it's gonna be tough, right? You know, let's brush up on our seasons of The Walking Dead and just see how things rolled out there, because you know that's the, you know, you can almost see it go. Maybe not that advanced so far, but you know, maybe like 5 years down the road from now it might get there. But yeah, we're still, we don't know where we're at, right? But it's something we definitely have to take more consideration at and take time to prepare. So with that, thank you for watching, and share if anybody you think needs to be more aware of this. It's hard to get people to understand it, man. I'll tell you, wow, a lot of people still won't budge on it. And even like some of my family and stuff, they're like, oh my God, they look at me in disgust. They really do. Oh my God, yeah, my friends. I talked to one of my friends today, and they're just like, dude, come on. I was like, all right, yeah, you know what I mean? Okay, I'm just giving up on the people who just don't even want to listen, because it's draining me. And you can't. It's like what you say. You can lead a horse to water, right, or something like that. But you can't make them drink. You can show people the path, but you can't make them walk it. So with that being said, 100% appreciate it. Stay strong. Peace.